the abrupt halt of U.S. foreign aid, ordered by President Donald Trump on January 20th and officially published on Friday, has inflicted serious damage, according to experts, severely disrupting global supply chains, crippling HIV clinics' access to essential medications, and jeopardizing vital services in refugee camps worldwide. The 90-day freeze on funding, with limited exemptions for military aid to Israel and emergency humanitarian food assistance, has sent shockwaves through the international aid community. The immediate cessation of all ongoing U.S.-funded projects, a stipulation included in the executive order, has placed countless lives at risk. Clinics in Uganda are desperately seeking alternative sources for critical HIV medications, their existing supplies brought. Brian Aliganiera, who manages a health clinic catering to the LGBT+ community in Kampala, Uganda, reported that the ARC Wellness Hub, reliant on the U.S. President's Emergency Plan for AIDS Relief, PEPFAR, for testing kits, HIV prevention and treatment medications, and operational expenses, is now facing a catastrophic shortage. PEPFAR, a crucial component of the aid freeze, provides antiretroviral drugs to 20 million HIV-positive individuals globally and supplies millions more with testing kits and preventative medicines. The abrupt disruption of this lifeline is causing immeasurable harm. In Bangladesh, aid workers express grave concerns about the potential collapse of infrastructure in sprawling refugee camps housing 1 million people. The U.S. historically provided 55% of the funding for the Rohingya humanitarian response, and a further reduction in funding last year already strained resources. An anonymous aid worker in Bangladesh describes a desperate scramble to prioritize the most critical life-saving activities. Similarly, in Ukraine, Andriy Klepikov, executive director of the Alliance for Public Health, highlights the devastating impact on mobile medical services in remote. These mobile units, providing essential care where access to clinics and medical professionals is limited, are now facing imminent shutdown. The U.S., the world's largest single aid donor, disbursed $72 billion, £58 billion, in the 2023 fiscal year. While the humanitarian sector anticipated challenges from Trump's policies, such as the reinstated global gag rule and threatened defunding of UN agencies, the immediate suspension. Many organizations were still assessing the full extent of the impact on Monday following the announcement. Dr. Atul Gawande, former assistant administrator for global health at USAID under the Biden administration, strongly condemns the order, stating it has caused serious damage to the world and the U.S. He cites the devastating consequences across multiple sectors: the halting of efforts to combat a deadly Marburg outbreak in Tanzania, the cessation of interventions against an Mpox variant affecting children in West Africa, and the suspension of programs monitoring avian flu, eradicating polio, and combating tropical diseases like river blindness. Essential healthcare services for pregnant women and childhood vaccination programs are also significantly im. The One Campaign, co-founded by U2 singer Bono, estimates that nearly 3 million children face a heightened risk of malaria due to the 90-day pause in the President's Malaria Initiative. Thomas Byans, who heads a consulting firm specialized in the humanitarian sector, emphasizes the far-reaching and severe repercussions of the sudden stop-work orders. This is due to the global system's heavy reliance on U.S. funding, which constitutes 42.3% of global aid funding, according to the UN, and as much as 54% of the World Food Programme's funding. The scale of the disruption underscores the critical role the U.S. plays in global humanitarian efforts. The ramifications of this abrupt action extend far beyond immediate financial losses, threatening the very fabric of life-saving interventions across the globe. The long-term consequences for global health and stability remain to be fully understood, but the initial assessments paint a grim picture of widespread suffering and disruption. The immediate impact is devastating, and the long-term effects are likely to be profound and far-reaching. The international community is grappling with the consequences of this unprecedented decision, struggling to mitigate the damage and find solutions to fill the massive funding gap left by this abrupt action. The consequences are stark and far-reaching, affecting vulnerable populations across the globe. The long-term consequences are likely to be felt for years to come.